Okay, guys, good morning. I cannot see myself, so I don't know if my camera's working or not. Can you please put in the chat? Let me know if you can see me, please. No. Okay. Hey, guys, do me a favor. Let me know, can you see me now or you still can't see me? Let me know, put in the chat. All right, can you guys see me now? Awesome, I'm in my husband's man cave. You see the Miami Heat behind me? Okay. All right. The weather's beautiful, so I decided to be outside today. Thank you, Warren. Okay, Lawanda. Hey, okay, everyone, welcome. Originally, I had this meeting to be 1 hour. I might go a little bit over, might not. It's gonna be more than just this one series. I think it's gonna be, all right, Kansas. I think it's gonna be a 2-part series. So what I decided to do was go over some important test taking strategies. And if you're currently in the nursing program, you can use them right now. If you're taking the Nclex, you can definitely use them. So I'm going to share my screen with you and get started. Okay, Zulima Vega, good luck. You're going to do great. Let me know how you do. Let me figure out how to share my screen. I haven't done a Zoom meeting in so long. I couldn't even tell you. Let's see. Here we are, share screen. Okay, guys, so I'm sharing my screen with you. Do me a favor in the chat. Where's this chat box? Put in the chat box if you can see my screen, please. I just want to confirm that you guys can see it, so I'm not talking for nothing. Okay, great. Thank you. Hello, Miss Julian, Mickey, Sierra, Chantel. Chantel, you do not play everything I'm doing. You are right there. You ready to take your boards? Yes, you have permission. You can record. I'm going to go ahead and post this on my YouTube channel.
I'm at work.
All right. So before I even start with this list, there are some very important things I have to tell you in regards to priority and delegation, because you are going to get so many questions in regards to priority and delegation, because Nclex wants to make sure that you know how to prioritize, you know what's most important. So hello, I love listening to you all. Thank you. So guys, make sure you have a pen, pencil, and paper available, because I'm about to drop some gems. I'll give you a second. Go grab yourself a piece of paper and something to write with. It states to ask you for permission to record. Oh, do I have to physically allow you? Let me see. Miss Jessica, I'm so sorry, but I wouldn't even know where to enable it. I'm recording from home. if I was recording at the office, IT would have set all of this up for me, but I like literally set this up yesterday. So I'm sorry, but it will be on YouTube, so you can watch this. All right, guys. So let's start with delegation. What can you delegate versus you have to keep no matter what? So let's start with the registered nurses. What are the things that only the registered nurse can do? You cannot delegate that to a licensed practical nurse. You cannot delegate that to a CNA or a PCT or an unlicensed assistive personnel. Care plans. The RN must write the care plan. They must develop that care plan. Now, the LPN is going to follow the care plan. LPN may assist the RN, but the RN has to keep the care plan. They're the ones responsible for the care plan. You cannot delegate that to anyone else. Care plan discharges. A patient that's about to be discharged, you have to keep that patient. And they'll trick you because in the question, you'll see the patient's a lot better. Heck, they're ready to go home. They're being discharged and you're thinking, okay, well, they're good. I can delegate that to an LPN. No, you can't. And here's why. With discharges come a lot of teaching and a lot of coordination of care. Okay. And remember that first and in-depth teaching, who's responsible for that? The registered nurse. So you can't delegate that to anyone else, which leads me to my next point. Admissions. You cannot give admission to anyone else. It has to be the registered nurse. Why? Because you're doing an in-depth assessment, in-depth teaching. Many of you students tend to think that LPNs can't teach, and that's absolutely wrong because LPNs can give medications. Do you think they're just going to give a medication to a patient without teaching the patient? Absolutely not. What the LPN can do is in-depth teaching, initial teaching. So the RN does that first teaching. The RN does that first assessment, and the LPN comes behind the RN. And when the LPN is giving, for example, the blood pressure med, they're going to assess the patient. They're going to take the blood pressure. And if the blood pressure is too low, they're going to withhold the med. So don't think that LPNs can't assess. Yes, they can assess. They just can't do the in-depth assessment, the initial assessment, because that belongs to the RN. But what LPN is going to give a medication and not assess their patient first, or do a procedure and not teach the patient? That makes no sense. So they absolutely can do teaching. They can do in reinforcement, but it's not the initial one. Okay, so let's go back to the RN. So RNs have to do the admissions, RNs have to do the discharges, RNs have to do the care plans. Blood, initiating a blood transfusions, the registered nurse. Okay, orders, and let me be specific about that. After the RN does admission and she realizes, whoa, this patient looks unsteady, I think they're going to need physical therapy. Who calls a doctor for orders such as a physical therapy, occupational therapy, speech therapy, DME? The registered nurse. Why? Because it takes an in-depth assessment to realize there's something going on with this patient that you need those orders, or the patient's going home and you want to order for home health because it has to be an order. The nurse cannot write the order. They have to get it from the doctor. The registered nurse does that. Okay. What else? Oh, the most at-risk patient. So if you have a list of patients, whoever's the worst off, the RN has to keep that patient. You are going to delegate stable patients to LPNs. You are not going to give your LPN any patient that is unstable. You have to keep that patient. What else? It'll come to me. There's more. So let's talk about the LPNs. So I talked about what the LPNs, you can't delegate to them, but what can you delegate to them? What can the LPNs do? And the LPNs can do a lot. I don't know why, guys, but I find that many times you guys want to treat the LPNs as CNAs, and they can do a lot. They can do wound cares. They can do suctions. They can do vents, absolutely. They can do IV therapy, you know, they can do PO meds, they can do trachs, they can do PEG tubes, they can do G tubes. So there are lots of things that LPNs can do. Are there typically LPNs in the ICU? No. Why? Because the patients in the ICU are critically ill. And who is responsible for the patients that are critically ill? The RNs. You cannot delegate an unstable patient to an LPN. And if the patient's in the ICU, they're unstable. Now, guys, remember, we're talking about the testing world. In the real world, what I'm telling you, you know, a lot of it contradicts, but we're talking about for testing purposes, okay? So there's a lot of things that the LPNs can do. But like I said, you know, admissions, discharges, first time assessment, first time teaching, getting orders for evaluation such as physical therapy or speech therapy or occupational therapy, blood transfusions, the most critical patient, those go to the RN. So what can CNAs do? Let's talk about that. CNAs can do a lot. They can do vital signs, but let me be specific because they will try to trick you on the Nclex. They can do vital signs, but they can record and report. That is it. They can't try to figure out what the vital signs mean. They can't interpret it. So for example, they can take the blood pressure and all they're doing is taking that blood pressure, they're recording that blood pressure and they're reporting it to the nurse, right? So why doesn't a CNA or an unlicensed assistive personnel, why can't they listen to lung sounds? Because listening to lung sounds requires critical thinking. You have to know what you're listening to. Are the lungs clear? Are you hearing crackles? Are you hearing rails? And guys, I'm not saying this to put UAPs down at all. I'm just saying this so you can understand the difference. So when you're testing, you can do well, okay? So they can do vital signs, record and report. They can do INOs, record and report. They can do glucometer checks. Now, I'm in the state of Florida, so check with your state, but most of the states, I haven't even heard of a state for Nclex that they can't. They can, because all it is they're taking the blood sugar and recording it and reporting it. They're not giving the patient insulin. During, oh, excuse me, 1 second. I just saw a question, 1 second. It says, during a blood transfusion, nurse is supposed to do the first set of vitals though, right? Or can CNA still do those and report it? The RN. Why? Because if that patient's getting a blood transfusion, they are not stable. The RN is doing that first set of vital signs. And that's part of that in-depth assessment that they're doing. Can LPN listen to lung sounds? Absolutely. It's the unlicensed assistive personnel that can't listen to lung sounds, right? But of course, LPN can listen to lung sounds because LPNs are allowed to give meds, right? So would you give a patient a bronchodilator without listening to their lung sounds? So absolutely, LPN and RN can listen to the lung sounds. It's the unlicensed, like a CNA, a PCT. They can't listen to lung sounds. What else can the unlicensed assistive personnel do? ADLs. Bathe the patient, wash their hair, help them brush their teeth, help them get dressed, activities of daily living. Unlicensed assistive personnel, they can remind the patient. They can say to the patient, don't forget, the nurse said to drink more water, so here, take a sip. Don't forget, the nurse said to sit up. Here, let me put some billows behind your back so you can sit up. So the UAPs can remind. The UAPs can transfer patients. They can transfer patients from one side of the hospital to another. If that patient's stable. If the patient is not stable, but they need to be transferred, guess who's going to be with that patient? The RN. Why? Because while you're wheeling that patient along or that patient's on the gurney, you're assessing that patient. Okay? What else? 1 second, guys. Sorry, my kids are homeschooled, so I have to check my phone because the teachers text me a lot for different things. So anyway, They're allowed to transfer patients from one place to another. They're allowed to transfer not resources. I'm trying to think of the name, like things you need, like if you need a gauze or you need, you know, an IV set, anything that you need, like they can go get it and bring it to you. Matter of fact, they're allowed to transport blood. So they're allowed to go over to the unit where the blood is and bring you the blood that you need, or they can go to the pharmacy and pick up the medication and bring it to you, because they're not giving that medication to the patient. They're not giving that blood to the patient. All they're doing is bringing it from one place to another. So for testing purposes, so you can remember, if it's your UAP, if it requires critical thinking, the UAP can't do it, okay? Can LPNs reinforce teaching done initially by the RN? Absolutely. That's what they're expected to do. Absolutely. All right. So I talked about responsibilities. Are they allowed to assist with, of course, LPNs absolutely are allowed to assist with procedures with the RN. So let's talk about, I talked to you about delegation. Let's talk about priority. You guys are going to get lots of questions about, you know, they'll give you different situations and they'll ask you, who are you going to see first? So you guys are always going to choose the patient that is most critical. And I'm going to give you some hints. If a patient was fine, then all of a sudden, write that down, guys. When you see all of a sudden, boom, you run into that patient. They were fine, then all of a sudden they have chest pain, all of a sudden they have dyspnea, all of a sudden they have restlessness, all of a sudden they have confusion. Oh no, ma'am, we're running to them. That's something acute, something just happened to that patient. We need to go figure out what's wrong with them, okay? So when you have a change, you have a decline in the patient status, that is a priority. Signs and symptoms of a cerebral vascular accident, where you see patients all of a sudden confused, where you'll see one side of the face, you'll see facial drooping. Any signs and symptoms of a stroke, that's going to be a priority. Hemodynamic status, circulation, any patient that is exhibiting signs and symptoms of bleeding. So you're looking at the labs and you see that H&H dropping. That heart rate has increased. That blood pressure has gone down. You're seeing blood in the stools. That patient's losing blood. That is a priority. Chest pain, that is a priority. And I don't care how they word it. If a patient is having chest pain and let's say they tell you, oh, they just had something spicy, we don't care. We're still going to assess you to make sure you're not really having a heart attack, right? So physiological integrity, guys, anything that keeps that patient alive or will kill them the fastest, that's going to be our priority. Airway, breathing, circulation, nutrition, fluids, fluid and electrolytes, glucose, anything that is physically keeping that patient alive, or without it, they will die the fastest. That's going to be our priority. You are always going to choose that over a potential problem. You're always going to choose that over teaching. You're always going to choose that over emotions, such as, you know, the patient has anxiety or they have concerns. Who cares about you being worried when you're dying, right? So that's what I mean by that. All right, Darrell, Crown Point, Indiana. Okay, so let's get into this list I have. Let's start with number 1. Do not read into the question. Guys, you're not Daniel Steele. Stop it. Stop creating your own stories. And I find that a lot. You know your stuff. But when you see the question, you start saying to yourself, what if? And then you create this whole situation in your mind. And by the time you go back to your answer choices, you choose an answer to the story that you created in your mind versus what they're asking you. So what I encourage all of my students to always do, before you choose that answer, go back to the question and ask yourself, is this answer answering this question that's in front of me? And if it's not, I don't care. how factual that answer is. I don't care how true and beautiful that answer is. If it's not answering your particular question, it's wrong. Keep it moving. Number two, Lawanda. Number two, Nclex land is set at a Utopia General Hospital. You have, oh my gosh, guys, this is so important, all the time, all the resources, all the staff, all the money. Anything that you need, you have enough of it, unless your question indicates otherwise. So let me tell you something, guys. I find that when I teach, and this is something I do every semester, I always like to teach 1 or 2 classes at a university so I can see how you guys are thinking, right? And it helps me pinpoint my teaching for the future. So anyway, okay, Chantel. Something that I find that the students who have medical background, such if they were, an EMT or an LPN and they're doing their RN or their PCT, they worked in the healthcare setting, they usually will refer to what they see on the floor to answer their question. And guys, 98% of the time, what you see happening in real life is not right. It's not textbook. Why? Because when you're taking a test, textbook, we're not concerned about money. So we don't care if it takes $1 million to do what we got to do for the patient. We're going to do it. We're not concerned about time. We're not concerned about overtime. We're not concerned about any of that. We're not concerned about resources. Guess what? We could drop 100,000 gauzes on the floor, and that's okay. We're just going to get some new ones, right? We're not concerned about that. We're not concerned about staff. In the testing world, you have enough staff to do whatever you need to do for the patient. So do not go back and rely on what you see happening on the floor, because that's usually the wrong answer. Don't choose that. Choose what the book says. As a matter of fact, if you have medical background and you're studying and you see something in the book and you laugh to yourself, you're like, yeah, right. We never do that in the real world. Highlight it, put a star next to it. It's going to be a test question. Remember, guys, the purpose of Nclex is to make sure that you're not going to go out there and kill my grandma, my auntie, my uncle, my cousin. You have to be a safe nurse. You have to be the type of nurse. You guys ever had a coworker that nobody liked because they were all up in everybody's business? They thought they were a manager. Everything was a big deal. Every time you see that person on the schedule, you're like, oh gosh, I got to work with this person. That's who Nclex wants you to be. Nclex wants you to be a prudent nurse. That means very careful. Everything's a big deal. That's who Nclex wants you to be. Because when everything's a big deal, it's hard to make a mistake, right? So that's how you have to think when you're answering those questions. Think to yourself, what would the annoying nurse that nobody wants to work with, what would they do? That's what Nclex wants you to choose. All right. Number 4, I teach this all the time. If you've been following my YouTube channel, you know this. Do not choose absolutes unless you know that you know that you know that you know that's the answer. 98% of the time, that's not the answer. Stay away from absolutes. Always, only, never. Stay away from them. Most of the time, that's the wrong answer. So don't choose it unless you know for a fact that is the correct answer. As a matter of fact, when you're studying your textbook, you're reading, and you see those words, you see only, underline that. When they tell you to only do something at this time, or you see that word always, to always do something, okay? Some other words, I'm getting a little bit off topic, but this is important. Some other words, when you're studying and you see those words, highlight it. It's important to know. When you see avoid, if that textbook tells you to avoid something, highlight it, put a star next to it. You're going to see it on the test somewhere. Characteristic. If you see that in the textbook, they say, these signs and symptoms are characteristic of this disease, you're going to see it on the test somewhere. Classic. When you see classic signs and symptoms or a classic treatment, that means 99% of the time, whenever the patient has this, you're expected to do this, you're going to see that somewhere. Cornerstone. When you see that word cornerstone and you're studying, you're going to see it somewhere. Make sure you know what they're talking about. Something else I want you to pay attention to, guys. I don't even have time to go into that. Let me keep going because I need to get through this list. Number 5, assess the client before implementing a treatment or action. If there's a choice that permits to assess the patient, it's usually the answer unless in distress. 100% correct. ADPI. Oh, I'm sorry. Thank you, Jada. I skipped number 3. Thank you. Let me do this one. I'll go back to number 3. So here's what they're saying, guys. ADPI, assessment, diagnosis, planning, intervention, evaluation. You're always going to assess the patient before you perform an intervention, before you call the doctor. How you gonna call the doctor? Please explain this to me. So you're calling the doctor to say what? You didn't assess them. So what information is it that you're gonna call the doctor to get orders, right? The only time you don't choose to assess a patient is if they're in distress. So for example, the patient can't breathe. They can't breathe. Why would you pick up a stethoscope to listen to the lung sounds? What are those lung sounds going to tell you that you don't already know? That they can't breathe. So guess what? The fact that you saw they couldn't breathe, that was your assessment. Now your intervention comes next, okay? So you're always going to assess your patient first unless they're in distress. If they're in distress, guess what? The question gave you enough information to tell you that they're in distress, then you're going to do an implementation or a nursing intervention. Number 3, let's go back to number 3. Oh, yes, less invasive to most invasive. Guys, we always do this. We're always going to go from the least invasive measure to the most invasive measure. So for example, patient just became diabetic, right? What are we going to start with? Exercise and diet. That doesn't work. We got to put them, let's say they're borderline diabetic. Exercise and diet, that doesn't work. Then we're going to have to put them on an oral hypoglycemic. That doesn't work. Then they're going to have to what? Go on insulin. We always save invasive for last. We always go from least invasive measure to most invasive measure. What number am I? Okay, number 7. All right, if it's the first time doing something for or with the patient, such as vital signs upon admission to the floor or unit, or when transfers involved, the nurse must complete the assessment, including vital signs. Absolutely. Oh, I skipped number 6. Okay, I'll go back to that. Thank you. So guys, when it's the first time that you're doing something for the patient, it's going to be in depth. Patient just came in, you're doing an in-depth assessment from head to toe. You're getting history. You're getting everything. RN has to do that. It's going to be in depth, and that same goes for teaching. I talked about that earlier. All right, let me jump to number 6. I'm not wearing my glasses. Let me see if I can make this bigger. Maybe that will help me. Oh, that's beautiful. Okay. Number 6, priority goes to assessments and answers that deal with the patient focused directly and not machines. Okay, let me tell you what that's saying. The patient before the machine. So let me give you guys an example. So you have a situation where you're at the desk, you're looking at the monitors for the tele, you're on the tele floor, and you see that on one of the screens, you see a flat line. When you run into that room, I'm sorry, one second. Hey, Seb, I'm teaching a class. I'll call you back. When you go into the room, you're going to assess the patient. What if the leaf just fell off? You go into the room and guess what? The patient's reading a magazine. Did their heart stop? No. The patient comes before the machine, and the patient comes before paperwork. So whenever you have a choice to assess the patient or assess the machine, you're going to assess that patient first. All right? Whenever you have an option to assess the patient or go look through paperwork, you're going to assess the patient. And speaking of paperwork, going through a patient's chart, right? That is a form of assessment. As students, I don't know why, but you guys seem to get it in your head that assessment is only physically looking at patient. And that is not only what an assessment is. Anything that gives you information about the patient is an assessment. So physically examining the patient, that's an assessment. Asking them questions is an assessment. Going through that patient's chart to get information is an assessment. Anything that gives you information about your patient is considered an assessment. So when you have the option of going through the chart, which is a type of assessment, or checking the actual patient, you need to check that actual patient. Yes, DeBerry says, really important in the ICU, you can't rely on the machine for everything. The machine is telling you patient's having some type of dysrhythmia. You assess your patient. Okay, what number am I on? I think number 7. If it's the first, no, I did number 7. Number 8, if patient's an adult, answers with family options can be ruled out unless the patient's not competent to make their own decisions. Absolutely. If it's an adult, your questions are going to be directed to the patient, not the family member, unless that patient has dementia, is schizophrenic, has some type of disorder that has deemed them mentally incompetent. Okay, then their guardian, or whoever has been appointed as their the person that you go to for their medical issues, that's the only time that you would go to that family member. Okay, that's for an adult. Now, if it's a child, who are you going to go to? The parents. Oh, let me jump on something else real quick, because Nclex loves to ask about this. So, if the patient is mentally competent, they can make decisions for themselves. They can make decisions for their child. Now, when can a child that's underage, so they're less than 18, when can they make their own decisions? Let me tell you, if they're married. If they're legally married, they can make their own healthcare decisions. You don't go to the parents. They're emancipated. They went through the court, and the court deemed them competent to make decisions for themselves. They're their own adult. They're in the armed forces. They can make their own healthcare decisions. Trying to think of other situations. But guess what? If they're underage and they have a child, this is tricky. They can make the decisions for their child, but they can't make decisions for themselves because they're still a child. Their parents have to make that decision for them, unless, like I said, they're emancipated, they're married, they're in the armed forces, okay? Very important. All right, what number am I on? Number 9, in emergency situations, mass casualties, patients with greater chance to live are treated first. You need to know that because they give a couple, like for each exam, and I'm talking about the Nclex now, the next generation 2023, guys, I'm going in blind just like you are. I know a little bit more because I stay on their website and I go to their webinars, but I'm saying as far as, things that are consistently seen over and over and over, I know as much as you do because this is new. But when it comes to mass casualty, usually on Nclex, you'll get like 1, maybe 2 questions on this. And it's very important to understand it's not the same as like triage in the ER. If you get a question, you're in the ER, you're the triage nurse, you're going to prioritize the most critically ill. Whoever's most at risk of dying, that's who you're going to take first. But in mass casualty, it's the opposite. And I hate to be insensitive, but that's just what it is. Whoever is most critical, is most likely to die, you leave them. You help out the person who's most likely to make it, so you can save as much people as possible. And that's kind of how you have to think about it. Let's see. By the way, guys, I have it in the works. I'm working on the Nclex review this year. Who plans on coming? All right, Daryl. Read. Okay, what number? Number 10. Thank you. Okay, Bianca. If you're asked about the first action you would take in a prioritization/discrimination question, think. Think, if I can only do one action and then I must go home, what will the outcome be? And that's absolutely true. So you can only do one thing. And I find that students, guys, you struggle with this because you'll see more than one right answer and you're not sure what to pick. But you have to say to yourself, if I can only do one thing for this patient, then turn around, what would it be? And when you think about it in that type of way, it makes it much more easier for you to correctly answer that question. I would love to attend, but I'm planning on testing at the end of the month, and I'm praying. You'll pass. Pray, and you pray, study. You'll pass, Lawanda. All right. Therapeutic communication. Number 11. Therapeutic communication will always provide an opportunity for the patient to express themselves, for them to describe what they're feeling or they're thinking. Any answer choice that does not provide that patient the opportunity to do that is not therapeutic communication. Offering self is therapeutic communication. So a patient's crying, they're upset, and you don't say a word, but you just sit down next to them. What are you doing? You didn't say anything to the patient, but as a nurse with a million responsibilities, you could be out there on the floor doing, charting, seeing other patients, but you're letting that patient know that they're valuable. And you're going to use your time to sit right there next to them. And when they're ready to talk about it, you're right there, ready to listen and answer any questions that they may have. That's called offering self. Offering self in silence is a form of therapeutic communication. Silence at the right time. So when you use silence, you're allowing that patient time to think about, what they're going through and to be able to verbalize it. Silence is a form of therapeutic communication, except, now listen to me here, guys, except when they're putting themselves down. Professor D, Nurse D, I'm so dumb. I'm such an idiot. And here I go. And I don't say anything. Is that therapeutic? No. That silence is letting the patient know that I agree, right? So yes, silence is a form of therapeutic communication unless that patient's putting themselves down. Then you better not be silent. Then you're going to say something. You're going to make an observation. You're going to say, you feel you're dumb? In the form of a question. You repeat back to them what they said in the form of a question. And they'll say, well, no, I really don't feel that. I feel X, Y, Z. Or yes, I feel like that because. The point is, because you threw it back to them in the form of a question, you did what? Allowed them an opportunity to express themselves. All right. Number 12, never say why. Do not ask why. Do not ask yes and no questions. And do not say I understand. So let me talk to you guys about this. I would like to attend the review. Where would I get the info? I'm still working on it. I had a location I was going to do a review. And, with COVID, I really wanted everyone spread out. And I don't know. I'm thinking I might just do an online review, which I really didn't want to do. But with COVID going on, it might be online. We'll see. But I don't have any information for it yet. I'm still working on it. You never ask why. And let me tell you, the reason you never ask why is the minute you say why to a patient, you want to know what you did? You put them on the defense. You put them in a position where they have to defend themselves, right? You never say why. You never say what made you. The minute you say what made you, you gave that patient a way out. So you're working on the psych unit and patient A punches patient B in the face. And you say to patient A, what made you do that? Oh, the voices in my head. There were no voices in the patient's head. They just wanted to do it. But because you said what made you, you just gave them an opportunity to shift the blame, right? You never say why. You never say what made you. You never ask closed-ended questions, except, write this down, when you do, will it be posted on TikTok? Yes, when I'm doing the review, I'll post it on TikTok. You never ask a closed-ended question except one, when you need a quick history. For example, patient just got in the hospital, you're rushing them to the OR, but there's pertinent information you need to know. Do you have allergies? Are you on any medications? Are you diabetic? Things like that. Yes or no. You need quick answers, right? You're getting a quick history. You're going to ask a closed-ended question. Abuse. When it comes to abuse, you do not beat around the bush. You ask that patient directly, are you being harmed, or is this person harming you? Yes or no. And here's why. The reason for that is because many people, you know, abuse is a sensitive subject, and so they kind of skirt around it, and the patient's never been asked directly. So they want the help, but nobody's ever asked them directly. Okay, so when you ask them directly, you're giving them that opportunity. Okay, so quick history or quick assessment, abuse, suicide. You ask that patient directly, are you having thoughts of harming yourself or anyone else? Yes or no. You do not beat around the bush. And if they say yes, your very next question is, how? Why? You want to know if they have a plan. So let's say they say, I plan on shooting myself. The very next question you're going to ask them, do you have access to a gun? Do you have a gun? You want to see how realistic that threat is. So if the patient says, oh, yeah, I want to harm myself, and you say, how? And they say, I want to kill myself by jumping off a mountain, but they're in South Florida. That threat is not as immediate as the threat of a patient who says they're going to off themselves with a gun and they actually have access to the gun. Hi, sorry to interrupt you, Professor D. Will this video be posted on YouTube? Yes, it will. I'm going to post it on YouTube afterwards. For a limited time. I'm not keeping it up for long, but it'll be posted. 14, when determining interventions to enhance a client's wellness, consider options that promote healthy nutrition, regular exercise, proper weight maintenance, proper rest, and avoidance of harmful chemicals such as nicotine. By the way, guys, when it comes to nicotine and you're teaching, okay, thank you. I'll go back to 13. I guess I skipped it. And you're teaching, you never tell a patient to slow down on smoking or tobacco. It's always stop, right? When it comes to alcohol, depending on the condition, you can tell the patient, oh, you know, you can have alcohol in moderation. You can, like, for example, only 2 glasses of wine a day. But when it comes to tobacco, there's never a moderation. There's never a slow down. It's always going to be stop. If you ever see, when it comes to tobacco, anything other than stop, that's the wrong answer. Don't choose it. Professor, can you take one-on-one tutoring? No, I stopped that years ago. I'm just way too busy. I can't do one-on-one tutoring anymore. I'm sorry. I skipped one. Let's go back to number 13. An answer that delays care or treatment is usually wrong. Example, reassess in 15 minutes. This is so true. If something is wrong with the patient, they're bleeding, you'd reassess in 15 minutes, so you let them bleed out for another 15 minutes just to come back to reassess and see, oh yeah, they're still bleeding. No, if something's wrong with the patient, you're always going to do something. You're not going to continue to document. You're not going to reassess. You are always going to do something, even if it's doing a further assessment. All right. Oh, number 14, which I already talked about. Nclex is very, very big on primary preventative measures. They're huge. Not only are they big on primary preventative measures that you have to teach the patient, they expect you to know the difference between your primary, secondary, and tertiary measures. So make sure you write this down if you don't know what those are. So primary measures, guys, those are primary preventative measures are things that you do for the patient to prevent them from getting that specific disease and disorder. So education and immunizations, those are primary preventative measures. So you're educating the patient on healthy diet so they don't become a diabetic. You're educating the patient on getting their influenza vaccine every year so they don't get the flu. Okay, that's a primary preventative measure where the patient doesn't have it and you want to keep it that way. So education, and the second primary preventative measure is immunization. So the patient doesn't have, chicken pox, but you're giving them the varicella vaccine. So those are examples of primary preventative measures. Now you have secondary preventative measures. Secondary preventative measures, we're testing to see if they have it, and if they do have it, how bad is it? So example of secondary preventative measures, mammogram. We're checking to see, does she have breast cancer? And if she does, how bad is it? Biopsy, colonoscopy, okay? So you're testing to see if the patient has it and how bad it is. Yes, Kate, absolutely. These are screenings, okay? They're not diagnostic tools, they're screening tools, and these are secondary preventative measures. Now we have tertiary preventative measures. The patient already has it. So, we're not trying to prevent it. We're not trying to see if they have it. We know they have it. They already have it, but we want to prevent it from getting worse. So tertiary preventative measures include, physical therapy, occupational therapy, speech therapy, right? Rehab. So very important. Make sure you guys know those. Number 15, if two of the answer choices are the exact opposite. Yes, honey, if you guys have been following me on YouTube for any amount of time, I talk about this extensively. Guys, if you have a multiple choice, A, B, C, or D, you have no idea what the answer is, but you notice that out of those 4 choices, 2 of them are opposite. Choose one of the opposites. 90% of the time, one of those opposites is going to be your answer. Choose one of those opposites. Absolutely. 16, if 2 or 3 answers are similar, none of them are correct. You need to choose the oddball. So you have multiple choice, A, B, C, and D. And you have no idea what the answer is. Obviously, guys, if you know what the answer is, just choose the answer. I'm speaking about when you have no idea what the answer is. And you notice that A, B, and C all have something in common. But D is the oddball, choose D. That's going to be your answer. 17, you want to look for an umbrella. Let me explain to you what that is. You have a multiple choice, A, B, C, and D. And you notice that A covers B, C, and D. Your answer is A. That's why it's called an umbrella. You know how an umbrella covers you? It shields you from the rain. When you see an answer that includes all the other answers, or it covers all of the other answers, that's going to be your correct answer choice. 18, if you've, yes, if you've never heard of an answer, do not eliminate, work around it. If you can safely eliminate all other choices, that is your answer. If you're down to 2 answers and you know one answer is right, go with what you know. Let me tell you guys something. You have horses and you have zebras. What are you more likely to see? Unless, well, let me not even say that, period. What are you more likely to see? Go ahead, type it in chat. Tell me, between horses and zebras here in regular life, what are you more likely to see? Thank you. Horses. So horses, guys, are the medications, the nursing interventions, the treatments that you've seen. you've heard about, you've seen on a PowerPoint that the instructor showed you, you read about it in the book, right? A zebra is something that you aren't very likely to see unless you really go out of your way. Zebra is that medication, that treatment, that nursing intervention that you never heard in your life. Here's what you guys do as students. You read a question, you look at your choices, and you recognize A, B, and C, but you see D and you're like, I've never seen this in my life. And you have no idea what the answer is, right? Most of you choose D because you're like, okay, maybe I was texting my boyfriend while the teacher was talking about it. This must be the answer. No. I want you to think of things in this term. Remember how I keep telling you Nclex wants to make sure that you're a safe nurse? They only have a limited amount of questions to test you on to make sure that you're a safe nurse. So they're not going to ask you about a medication that is hardly ever given, that only 1 in 20 million people ever get. They're not going to waste a test question on that. They're going to test you on diseases and medications you are more likely to give on the floor. Why? They want to make sure you're safe. So if you have no idea what the answer is, choose what you're familiar with. Choose what you've been taught in school, okay? Don't choose the zebra. Number 19, prioritize actual over potential. I talked to you guys about that. Your priority is going to be what's going on with the patient right now, not at risk for, not a potential problem. 20, do not leave the patient thinks, let me tell you something. If that patient is in distress, you do not turn your back to go get anything. What do? You stay with that patient, you scream at the top of your lungs for help, but you do not leave that patient alone. 21, do not do nothing. I cannot stress this enough. Nclex wants to make sure that you're a safe patient, a safe nurse. So it is very rare that they'll waste a test question on nothing being wrong. Something's always wrong. Why? They want to see if you know what to do. So before you choose that option of continue to monitor or document, before you choose those answers, go through those other choices, ask yourself, is this something that I can do for this situation that will help my patient? Because most of the time, guys, Nclex is not going to waste a test question on nothing being wrong. The whole point of Nclex is to see if you're a safe nurse. Is calling the MD count as something? Yes, calling the MD does count as something. Here's the problem. When you have the answer choice of call the MD, or if you're an LPN watching this right now, for you, it's not going to be called the MD, it's going to be called the RN. So whichever. When you have that option of call the RN for LPNs or call the MD for RNs, look at your other choices and say to yourself, can I do this for my patient before I call the doctor? Is this going to help? So I'm gonna give you a perfect example. Patient just had leg amputated, left below the knee amputation. You go into the room and that patient is hemorrhaging, right? And you have choices of putting pressure on the wound, of applying eyes, of calling the doctor, of putting a tourniquet on, right? And that patient is bleeding. Of course, you're going to call the doctor, but is that the first thing you're going to do? So while that patient's bleeding to death, you're on the phone with the doctor like, yeah, this patient's bleeding to death. What do I do? No, you're going to put a tourniquet. By the way, guys, that's one of the few times you're ever going to put a tourniquet on the patient. But you're going to put a tourniquet to stop that bleeding to save that patient's life. Because above the knee amputation and that bad boy's bleeding, let me tell you something. Pressure is not going to stop that bleeding. All it's going to do is get blood all over your gloves, all inside of your gloves, all over you. You apply a tourniquet to stop that bleeding, or at least slow it down. After you apply the tourniquet, you call the doctor and say, hey, I walked in the patient's room. They were bleeding out. I placed the tourniquet. What do you want me to do next? So even though calling the doctor is something you should do, that's not your priority. You have to always think, what is it that's going to save the patient's life? So I'm happy you asked that question, Kate. Yes, calling the doctor is an intervention. Anything you do for the patient is an intervention. But before you choose that answer, look at your other choices and say to yourself, can I do this for my patient before I call the doctor? Okay? The doctor will always want to know what you did first. That's right. You better do something. Do not do nothing. You always have something to do. I talked to you guys about that. 22, if the question's about endorsement, always report anything new or different to the, next shift. Absolutely, anything that's changed on your shift, you're always going to want to let the next nurse know about it. Excuse me, let the next nurse know about it. But this kind of reminded me of something else Nclex loves to question you about. Let me tell you guys something. You don't pass the buck. So if the patient asks you a question or they have a concern, you don't tell them, oh, we'll talk to the doctor about it when they make their rounds, or talk to the nurse on the next shift. No, you do your job. You answer their question. After you answer the question, you can say, there's certain, for example, you can teach them about, you can teach about a medication, but if there are other options that you're looking at, you can discuss that with the doctor when they make their rounds, because you don't want to step out of your scope of practice. But anything that is within your scope of practice, you have to hold on to. You don't pass the buck. Lawanda says, but after your explanation,
What's she doing here?
guys, please make sure you're on mute. I had set it up for everybody to be muted. So if you're not muted, you turned off the mute. Please put yourself back on mute. I get tripped up from the one. I get tripped up sometimes on what is the best versus the first versus the first in. Wait. Okay. Where is it? I get tripped up sometimes on what is the best versus the first. Usually when you get the test questions that says, what is, let me start with what is the first. Obviously, that's what's the first thing that you're going to do for the medication for the patient. But when I tend to see best, I tend to see that in regards of teaching, and you always have to go back to the body of the question. So if they're talking about a medication, it's going to be the teaching versus if you're talking about the disease process. Guys, please mute yourselves, please. You can mute them too, Professor. I don't know. Let me see if I can. Okay, give me a second. Let me try to mute everyone. I don't want to stop video. Click on his name and mute him directly. Okay, who do I need to mute? Andre Alexis. Andre Alexis. There's so many people on here. I don't know if I'm even going to find them. Andre Alexis. Andre Alexis, can you please put yourself on mute? Andre. Andre Alexis is on mute. Okay. Okay. What number am I on? I'm sorry, Professor. Can you explain what you mean by endorsement when you're giving report? You're just passing everything on. 22's next. If the question's about endorsement, always report anything new or different on the next shift. 23, only select document if the assessment is normal. Everything has to be normal. If something's wrong, you're not going to document, guys. You're going to either perform an assessment, which is either looking at that patient, going through the chart, asking questions, or you're going to do an intervention. 24, put patients with the same, oh, yes. So guys, very important. Nclex loves to ask about this. You need to understand that you are not going to put a patient that has an infection in the room with a patient without an infection, okay? If a patient has an infection and you have to room them with somebody, it's going to be another patient with an infection, hopefully the same type of infection. If you can't, like, because of your choices, there's nobody else, it is what it is, but you are not going to put a patient in a room without infection with a patient in a room with an infection. 25, this is self-explanatory. Never increase a patient's fluids to catch up. So they'll give you an example that you were supposed to give 100 milliliters in an hour. It's been half an hour. You go into a patient's room, and guys, when you go in the patient's room, there was supposed to be what, 50 milliliters left. You were giving 100 in an hour. It's been half an hour. You expect to see 50 in the bag, but then when you look, you only see you expect to see 50 in the bag, but then you look, you see 30 in the bag. Or let me make it more, you actually see 80 in the bag, right? You're like, oh crap, 30 mL should have already gone into the patient, but it didn't. Are you going to increase that rate just to catch up? Absolutely not. You can't increase the rate. Answer, select all the questions. You guys know I talk to you about this all the time. Answer as true or false. That's how you get the select all that applies correct. Okay, don't try to clump them together to try to make it right. By themselves, if it's correct, you choose true, and if it's incorrect, you choose false. My nose is running. Give me a second, guys. I'm gonna go get a paper towel, please. All right. '27, rephrase a question in your own words. This ensures you understand what the question's asking. If you can't rephrase a question, you do not know what the topic is. Now, let me add this, guys. When you rephrase the question, don't create your own story. I find with students, it's helpful for you either to underline or to highlight important things that are going on, such as the patient's disorder, what's going on with them, the medication that they're taking, and vitals. 28, if you can't determine the topic of a question, read all answer choices to help you understand the problem. Look for patterns. That's what they mean. Oh, it says look for patterns. Try not to determine the answer before reading the answer. Let me tell you something. So many students will get a question wrong because they'll read a question and they're not done with the question, but immediately, so for example, they're reading a question and it says, you know, the patient's in the hospital and their great toe is extremely swollen, it's painful to touch, they're getting colchicine, you know, what would be a condition that you stop giving them the medication, right? But as a student, they're reading the question, and as soon as they see the great toe is swollen, it's tender touch, they say to themselves, gout. And when they look in the answer choices, they'll see an answer choice that says gout, and they choose it. But does gout answer the question, which was, why would we stop giving this medication? No. But if they read the whole thing, they continued, and we saw that this patient was taking colchicine, and they're asking, why would we stop this medication? Then they would say to themselves, oh my gosh, well, we'd stop this medication, you know, if the patient was getting colchicine toxicity, let me look for signs and symptoms of colchicine toxicity. Okay. Before I go on to the next one, it reminds me of something else that Nclex loves to do. You guys have to be aware of this. Let me tell you something. When it comes to medications, when they're telling you about a medication, so they tell you the patient's taking, for example, colchicine, okay? When they're asking you about a medication, usually they want to know one of these three things. The indication, which they hardly ever want to know the indication, because that's too easy. But sometimes you'll get that where they just want to know, why is the patient taking this medication? The indication. But more importantly, the adverse effects. What is something that this medication can cause that as a nurse, if I see it, I'm going to call the doctor right away? Or as a nurse, if I see it, I'm going to teach a patient, if they see it or this happens, to call us right away, right? Adverse. And the third one, what if this medication works a little bit too well? So for example, you're giving insulin. What if insulin works a little bit too well? Guess what? Your patient's on the floor. Why? Because they had a hypoglycemic reaction. So what students tend to mistake when they're being asked about a medication, instead of answering the question about the medication, they answer the question about the disease process. So for example, you get a question about a patient that's diabetic and they're taking insulin, and they're asking you about insulin, but when you're looking at your answer choices, instead of choosing the answer that's actually about the insulin, you choose an answer that's about diabetes. I've seen this happen so many times. So guys, be careful. If they're asking you about the medication, stick to the medication. Indication, adverse effect, and obviously your nursing intervention for that adverse effect. And if what happens if that medication works a little bit too well? And obviously the nursing intervention for that, okay? Don't answer about the disease process if they're asking you about the medication. All right. Where am I? 30, more often than not, pain will not be your answer. Oh my gosh, if this is not true. So there are 3 situations where pain is going to be a priority. Pain is never a priority, except, write this down, guys, myocardial infarction, burns, sickle cell. And depending on the situation, cancer. but definitely every single time. Myocardial infarction, pain is a concern. Okay, that patient's going to need that morphine. Burns, pain, because let me tell you something. In myocardial infarction, in burns, and in sickle cell, and in some situations, cancer, that pain is so great, it can put the patient's physiological integrity at risk. And remember, physiological integrity, that's our priority. So that's why I say pain is never a priority except in those situations. So you guys definitely need to know that. No, but I'm working on a book. I'm working on Nclex prep book and an Nclex review website where you can pay a subscription. It's like a UWorld, except it's going to be my own version. I'm working on that. I'll let you guys know when that's up. Oh, thank you, Kate. You watch me on YouTube. I know you do. Thank you, Kate. Kate said stones. Absolutely. And guys, it doesn't matter what type of stones. It doesn't matter if it's kidney stones, calcium stones, struvite stones. If the patient has a stone, pain is a priority. Thank you. Absolutely. That's going to change your physiological integrity, starting with heart rate and blood pressure. Thank you so much, Kate. I know you watch me on YouTube. Absolutely. 100% correct. All right. What number am I? Oh, I skipped 29. Try not to determine the answer. No, I read that. 31, try to focus on the here and now as much as possible. Your priority will always be, thank you, Kate. Your priority, oh, I was your professor? Kate. Kate! All right, I know who you are now. I know who you are. Hi, Kate. Don't say the school though. Okay, guys. Oh wow, that's so funny. What was I? Yes, your priority is always going to be what is acute, what's happening with your patient right now. I'll be on my way to that school in a heartbeat. Read, that's exactly why I stopped saying where I teach. That is exactly why. You will not believe. Students literally left the school they were at and came to and it caused so much issues. And by the way, guys, I move around. I don't like to only teach in one place. I like going to different places because it really helps me understand your mindset when you guys are choosing all these crazy answers. Like after I give an exam, I like to ask my students, like, what the heck were you thinking? Like, I really want to know because it helps me think how you guys are thinking so I can correct it. But it happened, and I'm talking, there was a mass exodus from one school to the school that I was teaching, and I couldn't believe it, and I don't want those type of problems. I don't want to make enemies, so I don't do that anymore. I never tell anybody where I teach. Okay, let's keep going. So yes, whatever is acutely happening with your patient, that is always going to be priority over later. If there's something that you can deal with later, you're going to save it for later. Whatever's acutely going on with the patient, that's what you're going to deal with now. 32, with positioning questions, you're trying to prevent or promote something, evaluate the outcome of each option. Let me tell you something. If a patient has any trouble breathing, shortness of breath, dyspnea, COPD, asthma, I don't care. If they have any trouble breathing, you are going to have them sit up as much as possible. Why? Your diaphragm is right here under your lungs, right? You take a deep breath, it pops down. You breathe out, it pops back up. Deep breath, pops down. To make room for the air, take a breathe out, and it pops back up. So what happens is gravity, when you're sitting up, helps that diaphragm to go down. So when you take a breath, you can get more oxygen. When that patient's lying down, guess what? Their own fat, their own abdominal girth is going to be pressing against their lungs. You think the lungs are going to be able to expand and they don't have gravity helping them? Absolutely not. Thank you, Daryl. Another example, patient that had amputation, that first 24, 48 hours, you want to decrease swelling because you don't want that stump that you're going to end up having to get, the patient going to get the prosthesis. You don't want it to get swollen, any damages. So what do? That first 24 to 48 hours, you have that stump elevated. But if you keep it that way, guess what? You're going to end up having contractures of the hip. By the way, hip contractures is one of the most common complications of amputees. So what are we going to do? Lie them prone. Because when you lie them prone several times a day, you're doing what? Forcing that stump back down so the patient doesn't have contracture, right? So whenever you're being asked about how you're going to position a patient, you got to think about the disease or disorder that that patient has and how the position is going to help them. 33, when the question asks what is essential, they're thinking safety. So whenever they're asking what's essential, what's most important, you need to be thinking about what's going to keep my patient alive, what's going to keep them safe. I'm glad to hear that, Lawanda. All right, 34, if you do not know what a word means, try to break it down, such as rhabdomyosarcoma, myomuscle sarcoma, tumor of the muscle tissue. I do that a lot in my YouTube videos, and I do it on purpose so you guys can learn how to break these words down, so that even if you didn't know what the answer was, because you were able to break down that one word, you're able to figure out the answer. 35, make an educated guess. If you can't make the best answer for a question, after carefully reading it, choose the answer with the most information. You have no idea what the answer is. You look at your choices, you have no idea. You look for opposites, you didn't see any. You look for answers that had similarities so you can choose the oddball, you didn't see any. You can't even make heads or tails of what's going on. Choose the answer that has the longest typing, the longest, the most words, I should say. When in doubt, choose safety. You're always going to choose what is safe for your patient. Okay, guys, I'm going to answer some questions. So if you have some questions, go ahead, put in the chat. Maybe I'll answer yours, but I'm going to stop here. I'm going to show you, because I have so much teaching, but just out of this alone, I'd be here forever. How many pages is this? Okay, 113 pages. So I'd be here forever, but I will answer some questions if you have any. Would you consider ever? Nope. What Nclex prep do you recommend? Okay, if you're testing before April of 2023, here's what I recommend, and it all depends. If you're a strong student, so for example, in nursing school, I was a strong student. I was the one teaching all of my classmates. You know, all I did was study. Like, I would eat this stuff up. I love it. I was able to go directly to exam cram RN, study out of that for 30 days, boom, I took my test, no problem. But if you're a student that really has been seeing your way out, okay, you've really been struggling through the nursing program, you got to build up to exam cram. So what I would encourage you to do is start with Saunders. Saunders is a great resource. Don't do Saunders anything less than 5th edition. That's going to be too easy, okay? So do 6th edition or higher, right? And then what you're going to do 100 questions a day. When you see you're averaging 80% or higher, move on to exam cram. Either, or, you know, I'm old school, guys, so I'm all about the book. But if you're more about the computer, another great program is UWorld. And I have no sponsors, so I'm just telling you this because it's the truth. Nobody's paying me to say this. But if you're not a strong student, I would not start with UWorld. I would start with Saunders, get that foundation, then go to UWorld or exam cram. UWorld is very hard. I'm telling you, if you see you're averaging 65, out of doing those 100 questions a day, you're ready to go take your test. Professor, I appreciate you so much. I passed my Nclex Tuesday. Congratulations. Oh, let me read the rest of the question. No, I'm sorry, I don't. I take my Nclex on Tuesday and the pressure is tough. Don't worry. Just keep studying and pray. But you guys have to be, I love Hearst. You guys have to be diligent and you have to be consistent, okay? So you have to, out of 7 days of the week, you need to be studying for 5 days and you need to be doing 100 questions per day. Now, I'm not saying just question, answer, question, answer, question, answer. You do your 100 questions, you choose your answer, and then you have to go back. Any answers that you got wrong, and it wasn't like you just clicked the wrong answer. You truly thought that was the answer and it wasn't the answer you got wrong. Go back and look it up. Look at that rationale, see why you got it wrong. Or even if you got it right, but you just guessed, you really didn't know that material, read the rationale. And if that rationale is not enough, you need to go back to your textbook. I failed Mara and Nclex and I just started UWorld and I retake at the end of January. Okay, well, UWorld is a great resource. I'm going into my last semester at Psych and Complex Med Search Health Alterations. Will you be making practice question videos related to those specific? I have lots of videos related to the, let me see, the Psych and the Med Search. A whole playlist. Go on YouTube and I have a whole playlist on each. So here's how you want to use it. You want to read before you go to class, listen to lecture, take notes, then after class, go back and watch my video on whatever you learned that day. I'm telling you, it's going to make it all make sense for you. Should we review questions that half of our peers took and got it wrong? Like, why would we review if only 10% got it right? I'm sorry. My mom is a bugaboo. She will call me back to back if I don't pick up. Mommy, I'm teaching a class. Can I call you back? Thank you. Any tips for OB peds? Oh, yes. Same thing, guys. OB peds, you're going in there, read the chapter before you go to class, like whatever's on your syllabus. It's not going to make sense. That's okay. Still read it, because when you go to class and your instructor's lecturing about it, you're going to be like, oh, I remember this. Oh, that makes sense. So you're hearing it for a second time. Then when you go home, you go to YouTube and watch my video on what you just learned in school, and you're going to be like, oh my gosh, I get it. And then you start practicing questions. As a student, you cannot wait until you graduate to start practicing Nclex questions. You need to do it as a student, because those same Nclex questions are the type of questions you're going to have in school for your test. Read, go to class, come back home, watch my video, then practice questions. Any tips for burnout of the brain? Well, that's why I have my audio lessons. They're on my website. When you get tired of reading and you just can't take it anymore, but you know you have a test coming up and you need that information and you want that passive learning, put on your headphones and listen to me talk about whatever it is that you're about to test on. Because if there's anything that, if you guys have been following me, you know that about me. I'm about the meats and potatoes. I pull out the fluff. If I'm talking about it, that means it's important. You're more likely to see it on your test. So if your brain is just fried, go, get one of my audio lessons and listen to it while you're driving or while you're working out at the gym. Her audio lessons are great. Thank you, Reed. I listen to them on the treadmill. Great. During school, should the practice Nclex questions be Saunders? It doesn't have to be, but Saunders is a great resource. You can use Saunders, Delmar, Davis, Lippincott, Kaplan. There's so many. Any other methods aside from true or false? No, that's what it is. You have to look at each choice, and if it's true, you keep it. If it's false, you throw it out. YouTube has great ones too. Thank you. Mark Clemick, I love Mark Clemick. what you say really stick, especially oh, questions are going so fast. What's that book you use for pop quiz? If I had a penny for every time I'm asked that question. You know what? I'm going to show you guys just the library I have in my crazy office. Is all, well, it's messy. I'm not going to go in there. But guys, I use so many books for pop quiz. Literally, my house is full of books. So whenever I feel like doing a TikTok, whichever book is closest to me, that's what I do my pop quizzes out of. I use all of them. I use Saunders. I use Mosby's. I use Delmar. I use Davis. I use Lippincott. I use the Priority Delegations book. I use, you name it. You name it. Whatever book's next to me at the moment when I feel like doing a TikTok, that's what I use. All right, guys. Also textbooks, like sometimes when I don't do questions, but I just point out to you something that's important and you see I have a star next to it. That's how I teach my students. When I teach them, I teach directly by the textbook, and I'll put a star on what they're most likely to see on Nclex because that's what I'm most likely to test them on. All right, guys, that is it. I'm going to let you guys go. I hope you guys found this to be helpful. Please do me a favor. I'm really trying to help my algorithm and just get myself out there. Do me a favor, please. Go on my either TikTok or wherever you saw the video I made where I was announcing this. Leave a comment and say, I don't know, say whatever you want. But if I was helpful, if I suck, don't go on there. But if I helped you or you found this to be helpful, please go on there, leave a comment because it's really going to help my algorithm and it's really going to help me get on more people's pages to help my channel grow. All right, guys, I hope this was helpful. I don't know when I'm going to do the next one, but guess what? The more comments I see, the more I'll be inclined to do a part 2. All right, guys, I'll let you go. Have a great day. Study, pray.
Thank you so much.